My proposal is about moving to closed nursing units. At the hospital where I am employed, we will be moving to the closed unit staffing model during the next staffing period. During our meeting to figure out how we will make this happen, we have been discussing the pros and cons of this staffing model. What are closed nursing units? Closed nursing units manage their own nursing staffing and scheduling. The units will handle absences and vacations within the individual unit instead of staffing collectively with the other units in the hospital. There are many advantages to moving to closed nursing units, including increased patient safety, enhanced teamwork, and improved patient outcomes. Increased patient safety. With closed nursing units, there is more control over who enters and exits the unit. This helps to reduce the risk of infection and ensures that patients receive the care they need in a safe and secure environment. Enhanced teamwork. A closed nursing unit allows nursing staff to work more closely together and fosters a sense of teamwork. This can lead to better communication and collaboration among healthcare professionals, which ultimately benefits patient care. Improved patient outcomes. With a closed nursing unit, healthcare professionals can more easily coordinate care and monitor patients' progress. This can lead to better outcomes, including shorter hospital stays, reduced readmissions, and improved patient satisfaction. More advantages to moving to closed nursing units includes increased efficiency, better infection control, and specialized care. Increased efficiency. A closed nursing unit can help to reduce interruptions and distractions for nursing staff, allowing them to focus on patient care. This can lead to increased efficiency and productivity as well as better use of hospital resources. Better infection control. With a closed nursing unit, it is easier to implement infection control measures and to isolate patients who may be contagious. This can help to reduce the spread of infections within the hospital and protect both patients and healthcare workers. Specialized care. Nurses on the cardiac unit will be able to care for patients with heart health issues better than the nurses on the ortho unit. The nurses will be more knowledgeable and specialized with their care. Benefits to patients. Benefits for closing the nursing units include increased safety and security, better continuity of care, improved patient satisfaction, and enhanced clinical outcomes. Increased safety and security. Patients on closed nursing units often are more vulnerable than other patients in the hospital. By keeping the unit closed and limiting access to only authorized staff members, patients are less likely to be exposed to potential safety risks, such as infections or falls. Better continuity of care. With a dedicated nursing staff and consistent team of healthcare providers, patients on closed nursing units receive more consistent and coordinated care. This can lead to better outcomes, fewer medical errors, and fewer hospital readmissions. Improved patient satisfaction. Patients on closed nursing units may feel more supported and cared for by a dedicated team of nurses and other healthcare providers. This can lead to better overall experiences. Enhanced clinical outcomes. Patients on closed nursing units may have complex medical conditions that require specialized care. By providing this care in a dedicated and focused environment, patients are more likely to experience positive clinical outcomes such as improved health and faster recovery times. Some challenges of implementing closed nursing units include staffing and training requirements, changing in workflow processes, and resistance to change. For staffing, closed nursing units require a higher staff to patient ratio than other hospital units. Staffing levels must be carefully planned to ensure that patients receive the necessary care without burning out the staff. Training. Nurses and other healthcare professionals who work in closed nursing units require specialized training to understand the specific needs of patients with the conditions being treated. This training may include infection control, isolation precautions, and specific medical interventions. Workflow processes. Patient assignments. Assigning patients to nurses on a closed unit requires careful consideration of patient acuity and nursing workload. Patient assignments may need to be adjusted to balance workload and ensure that each nurse has a manageable workload. Documentation. Nursing documentation systems may need to be modified to reflect the closed unit structure. Documentation systems should allow nurses to easily access patient information and document time in a timely and accurate manner. Patient flow. Patient flow processes may need to be revised to reflect the closed unit structure. For example, admission and discharge processes may need to be streamlined to ensure that patients are admitted and discharged efficiently. Resistance to change. Moving to closed units can be a significant change for both nursing staff and patients, and it's not uncommon to encounter resistance to change in such situations. Here are some strategies that might help you manage resistance to change. Communication. Communication is critical when implementing changes in a healthcare setting. Make sure that you communicate clearly and effectively with nursing staff and patients about the reason for the change, what the change involves, and the benefits it will bring. Address any concerns or questions that they may have, and provide ample opportunity for feedback and discussion. Training. Implementing new protocols or procedures in a nursing unit can require a new set of skills or knowledge. Make sure that staff receive the necessary training to ensure that they feel confident and competent in the new system. Empowerment. Allow staff to take ownership of the change and encourage them to make suggestions and provide feedback. This can help to create a sense of ownership and investment in the new system, making it easier for them to embrace the change. Collaboration. Encourage collaboration between staff members during the transition. This can help to create a sense of shared responsibility and support. Celebrate successes. Celebrate successes and milestones along the way. This can help to create a positive environment and maintain momentum. Strategies for implementing closed nursing units include: communicate the benefits of the new system to all stakeholders, provide training to staff to ensure a smooth transition, involve staff in the planning and implementation process, and address concerns and resistance to change. Identify the key stakeholders. This may include nurses, physicians, patients, family members, and other staff members who will be affected by the change. Develop a clear and concise message. Create a message that explains the benefits of closed nursing units in a way that is easy for stakeholders to understand. This may include improving patient safety, reducing the risk of infection, and improving communication among the healthcare team. Provide education and training. Providing education and training for all staff members on the new system will be a huge help. This may include training on how to use the equipment, protocols, and procedures. Address concerns and questions. Encourage stakeholders to ask questions and express concerns about the new system. Address these concerns in a timely and respectful manner to help alleviate any fears or uncertainties. Case studies of successful implementation. Johns Hopkins Hospital in Baltimore, Maryland has implemented a closed nursing unit for patients with dementia and delirium. The unit is staffed by specially trained nurses and features enhanced safety measures, including secure entrances and exits and alarms on windows and doors. Banner Health, a healthcare system in Arizona, has implemented closed nursing units for patients with behavioral health issues. The units feature specialized staffing and safety measures to prevent elopement and self-harm. Mercy Health is a healthcare system based in Ohio that has implemented a closed nursing unit for patients with traumatic brain injuries. The unit features specialized staffing and equipment, as well as enhanced safety measures to prevent falls and other injuries. These examples demonstrate that closed nursing units can be successfully implemented in a variety of healthcare settings for a range of patient populations and conditions. By carefully planning and implementing specialized staffing, safety measures, and communication protocols, healthcare organizations can provide a more secure and focused care environment for patients. I spoke with Marie Werthermer, RN, House Supervisor at Corewell Health South, and this is what she said about closed nursing units. When asked about moving to the closed unit staffing, Marie says, "One of the biggest problems we have with adequately staffing our unit is employee call-offs. That problem has gotten much worse during COVID and after COVID now that nurses are burned out. Nurses feel a sense of obligation to their coworkers, and instead of answering to a nameless group of people when calling off, now they are answering to their teammates. They tend to think twice before calling in because they don't want to let their teammates down." In conclusion, moving to closed nursing units can provide enhanced safety, improved patient outcomes, and better staff communication and collaboration. This includes enhanced safety, improved patient outcomes, staffing considerations, and communication and collaboration. Overall, moving to closed nursing units can offer a range of benefits for patients and staff, but it requires careful planning and consideration of the potential risks and limitations. It is important to carefully consider staffing and resource needs, as well as ethical considerations related to patient autonomy and freedom of movement. A closed nursing unit can offer enhanced safety and security for patients, staff, and visitors. This is particularly important in facilities where patients may be at risk of harm or elopement.